the years, MS Teamworks has shared perspectives on MS from all members of the MS team. And although 2020 brought unexpected challenges, we were determined that a pandemic and social distancing would not stop us from sharing new and meaningful perspectives. The setting was different, but the message is the same. I have MS. I have a team. I have a future.
My name is Pamela Boyle, and I am very fortunate to have worked in the field of rehabilitation, most specifically in the field of sexuality and disability for 42 years. It's an exciting field to have worked in, and I'm a pretty fortunate person to have had that opportunity. I have a master's degree in rehabilitation counseling from Boston University, where a lot of the work I did there focused on intimacy, sexuality, and relationships and disability. After I finished my master's degree, I had the very fortunate opportunity to participate in a training program called the Sex and Disability Project, and it was a part of the University of California at San Francisco through the medical school there, their Department of Psychiatry, their human sexuality program, and it was a year-long training program for people interested in providing supports and services to individuals with a range of disabilities related to sexuality. So I was a fortunate member of a group of about 25 people who had the opportunity to do that training. I have worked in a large number of service providing agencies, hospitals, community programs, always focusing on this very important issue of sexuality, intimacy, relationship development, and disability for all of these years. And it has been just certainly my pleasure and my privilege to do that. I had the very great fortune to be raised in a family that included a man living with a spinal cord injury and my mother, who was a nurse. So my exposure and my experience with people living with disability happened very, very early, which I think set me on a very wonderful course for the work that I do today. Early on in my college career, I had an opportunity to participate in several new program opportunities called SARS. That stands for Sexual Attitude Reassessment Seminars. And these SARS were generally weekend programs that trained professionals to have a much better understanding of sexuality and people living with disability. These were very popular programs at one time. Some still exist, but not with the focus and not in number as they did at one time. In graduate school at Boston University, Sargent College, much of the work that I did was related to sexuality, body image, relationship development, and people living with disability. And one of my early jobs was to work in a large rehabilitation center under the guidance of the director of psychiatry there. And I had an opportunity to work with many, many people, newly diagnosed, some who had already been diagnosed and were living with MS, and worked with them on issues of sexuality. It was a great opportunity, and I learned a great deal from all of those people, and certainly benefited greatly from their desire to teach me. I had a professional colleague in an agency that I had worked for that was not related to MS who left that job and went to the Long Island, New York chapter of the National MS Society. And we had kept in touch because we were close friends. And at one point, she had invited me to participate as a member of their professional advisory committee, which I did for a few years. But later on, she had asked me if I would facilitate the newly diagnosed groups that were run and provided by the chapter. And that was certainly a wonderful experience, helping people in the early stages of understanding their diagnosis and coping with all of the fears and feelings that they had in regard to that diagnosis. Later on, I helped facilitate a wonderful program that I do highly recommend called Relationship Matters. And it was a couple program over the course of a weekend that offered couples an opportunity to speak about lots of couple issues related to a diagnosis of MS and living with MS, and was certainly one of the highlights of my professional career. I've had wonderful opportunities to learn directly from people living with MS, and certainly I'm thankful to the Long Island chapter of the MS Society for giving me that opportunity. The difference between sex and sexuality is, I think, kind of distinct and kind of important. For a very long time, we spoke of sex education, of sex, as that little short piece of sexuality. But in all honesty, I think that sex really is often now more used to refer to the act of sexual intercourse, as in they had sex, and is also kind of the division of the categories of people based on their reproductive organs. Sexuality is a far more expansive and I think valuable term to use when I work with people who have disabilities, such as those people living with MS. And certainly sexuality for me, again, is a large topic. But to narrow it down for the purposes of this presentation, let me say that sexuality starts with sensuality, which can be described as body image, sexual pleasure, and response, that need that we all have for touch, and perhaps fantasy as well. Intimacy is also a part of that expansive term, sexuality. Intimacy includes the caring and sharing that our involvement in an intimate manner with another person includes. It is the loving and liking part of that interaction. It includes some risk-taking and revealing of ourselves and a bit of vulnerability. Sexual identity is a part of our sexuality, and that is pretty much defined in kind of simple terms as who one is sexually and one's sense of oneself in maleness or femaleness. Sexual health and reproduction is certainly part of our sexuality, and that would include attitudes and behaviors related to things like reproduction, care and maintenance of our reproductive organs, and health consequences related to our sexual behaviors and choices. And the last part of our exploration of what sexuality includes is the issue of sexualization. Sexualization is the use of sexuality to influence or control or manipulate other people. That all sounds somewhat negative and certainly can be. Those negative sexual experiences that we have in our lives, some of us, many of us, can certainly impact or damage one's sense of their own sexuality, their own sense of themselves. So that is certainly something to be considered. So we're talking about sexuality to include sensuality, intimacy, sexual identity, sexual health and reproduction, and issues of sexualization. The issue of sexuality and disability for people living with MS is pretty well studied at this point. This is not new information, but it is important information. But also it is important to say that these issues do not impact every single person living with MS because everybody experiences life with MS differently. So please understand that nothing I'm saying here is a given. It is not an absolute. And if it's not part of your experience, it may never be. So I say that just in terms of clarification. But certainly some well-known physical function issues caused by the lesions of MS in men are certainly genital numbness and that pins and needles feeling, difficulties getting and or maintaining an erection, two rather different functions and sometimes different issues for a man. Difficulties with having an orgasm, both in terms of having an orgasm with ejaculation or a sense that things just have changed and are not as pleasurable as they once might have been. In women, a common complaint, a common concern, a common sadness is a loss of interest in intimacy or sexual activity. We use the term libido, a loss of libido. That drive, that interest, the excitement to participate, to engage may have changed. Certainly, difficulties with having an orgasm are reported by women, and again, it may be harder to come by and not feel the same or not meet the expectation that someone has. One of the common concerns in terms of intimacy and especially vaginal intercourse is a change in the lubrication within the vagina, which lead to either uncomfortable sexual intercourse, vaginal intercourse, or can certainly lead to something more painful. And obviously, anytime sex is not pleasurable, it can become more of a chore, more of something not to be looked forward to, and something that people may tend to avoid. There are difficulties that are a part of living with MS that have a potential direct impact upon sexual functioning and sexual enjoyment. And those would include things like pain or spasticity, which mean a change in sexual practice, things that are familiar and comfortable, things that have been a part of sexual expression in one's history, and mean that changes may need to be made that seem very unfamiliar and uncomfortable. It goes without saying that for some people living with MS, bowel and bladder issues can impact upon everyday life and may also then impact upon one's intimate life. Fear of bowel and bladder accidents, the embarrassment certainly that can come from that in one's most intimate moments, can certainly impact a person's willingness to engage and to then fully let oneself be present in that moment. The issue of fatigue is often reported as a general concern and issue that impacts everyday living, but can certainly have a direct impact on one's sexuality and one's sexual life. One thing that I know I've heard is that the issue of now having to plan a little bit more specifically, closely, and in terms of timing and preparation for intimacy is something that feels terribly unfamiliar and terribly uncomfortable at times. All of the literature and any body of information recommending preparation for intimacy includes planning and suggests that fatigue in most people is experienced differently, perhaps in different times of day. So learning to plan and feeling comfortable with the idea of planning for intimacy at the times when fatigue is at its lowest certainly can enhance the enjoyment of sexual activity and opportunities for intimacy. Things like keeping the room cool, those sorts of things also are well known to help people feel more comfortable and feel more successful as they engage in intimate contact with a partner. And lastly, I would say that, while this seems to be something that isn't necessarily as important as resolving spasticity or dealing with bowel and bladder issues, those issues, that social emotional part of living with MS and its impact or potential impact on intimacy is something that must be dealt with. If it's impacting your sexual pleasure, your sexual health, your relationship, your companionship, it's worth dealing with in an office, sitting, talking, and exploring. Issues like depression, a high level of anxiety or chronic worry, a change in one's body image, your sense of yourself as attractive, of desirable, interpersonal and general relationship difficulties, things that may have occurred and been in place prior to a diagnosis, because I think it merits saying relationships after an MS diagnosis brought to that diagnosis certain challenges and difficulties very often. So the things that were true and troublesome about a relationship or within one's personal life that were true prior to the diagnosis probably aren't going to go away when the diagnosis is also a part of the concerns of everyday life. So I think old stuff, history, also impacts upon current day progress. I think also the fear of being a disappointing sexual partner is extremely important to talk about. There are some very, very good verbal therapists out there. There are people who have great skills in both individual therapy and couple therapy. And there are, with some research, people who work at the intersection of sexuality and disability, of individual and couple therapy in general. So those people are really worth finding. And if you can find one, I think it will mean everything to you. I think it will improve so much about your life. It's got to be the right person and the right match, of course. If you can't find that person, your local chapter of the MS Society or other support provider, your physician, your MS Care Center, a nurse practitioner, your physical therapist may have a recommendation for you, and you should never, ever hesitate to ask. Partners can do many things to support a person with MS. The simplest answer that I can give, but probably one of the most difficult things to do well, is to communicate. I think many of us believe that we're great communicators and that we're not only great listeners, but we're great talkers and we express ourselves openly and honestly. I think sometimes if we really take a good look at communication styles, and how we do that, how we give and receive messages from our partners, especially, or for people who are important in our lives, we sometimes find that we are maybe not the skilled communicators that we like to believe that we are. When it comes to sexuality and intimacy, resolving issues, moving forward, growing, and taking this journey together, I think that it should go without saying that communication is the key. I think that we all need to be very good listeners and the partners of people experiencing life with MS. I think that is an essential skill to work on, if you can. And you can certainly have help doing that. You don't have to do it by yourself. We need to focus when we listen, and we need to listen with the intention of understanding, not with the intention of having a quick answer or solving a problem. Sometimes that isn't really what the person speaking needs. They need someone to hear what they're saying. And when something is as deeply personal as one's sexuality, I think the listener has a tremendous responsibility, an important responsibility to be the best possible listener that they can. Not only to be a good listener with a partner who is experiencing life with MS, but also to challenge yourself to share open, honest communication. But I will say, I think with an attention paid to words and the meaning and the power of words, choosing our words carefully and respectfully and with love is essential. I think to share as openly as possible as a partner one's own thoughts, one's own feelings, and one's ideas and suggestions when the moment comes for you to be the speaker, without seeking to solve anything immediately or having a quick answer. Because I think working through these things is really a journey. It's got a lot of stops along the way, and sometimes the journey changes. We have to take this road or that. But I think communication is absolutely essential if we are going to have any success with a partner to work through those very, very important concerns within any couple relationship. The issue of compromise, to find ways of compromising when it comes to life in general with a partner living with MS, but certainly compromise within the sexual relationship. And compromise is not a winning or losing thing. It is both people getting something that they want, both people finding pleasure, both people enjoying the opportunity for that contact, that intimacy. So it's not a win or lose kind of thing. It is really both people gaining, both people getting, both people enjoying. I hope that partners will become informed by reading, by taking advantage of literature, lectures, opportunities for conversation, so that they can feel reassured within themselves that their own concerns confusion, a sense of maybe being overwhelmed by their partner's diagnosis, or the challenges of living with MS. I think partners themselves need sometimes individual supports and services, and there are partner groups that provide support. I think to always, with intention, seek intimacy in any sexual contact, to contact this other person in your life emotionally and fully, and enjoy the skin-to-skin kinds of contact that are so much a part of what we do. I say this in suggesting that contact with the sexual organs, and we've heard this over the years in our field of sexuality supports and services as a provider, that vaginal intercourse, other kinds of overt sexual contact are one aspect of expressing our love, our care, our joy, our pleasure in being with a partner. So I think now is a time as a partner that exploration can be exceptionally exciting. It can be a great joy. Finding new ways, doing new things, suggesting things that maybe you might not have suggested in the past, and then finding ways of expressing, of sharing, of finding compromise. Again, I think that this is quite an adventure, and maybe not one that people might have chosen, but with flexibility, creativity, joy, love, respect. I think that this issue is something that couples who come to these challenges with all of those things, especially love, respect, and intention, can resolve and perhaps even find some new joy. A few of the takeaway messages of this brief talk on sexuality, intimacy, and living with MS are these. Sexual pleasure and intimacy is an important part, and some would say an essential part, of living a life. Additionally, you have a right to expect assistance and support with any sexual health issues that you are experiencing. You have a right to have your questions answered and to become more knowledgeable through assistance about the options for dealing with any sexual issues that you may be experiencing. This doesn't matter whether you are very young or whether you are older. It doesn't matter whether you are partnered or whether you have yet to find a partner. And it does not matter whether you are a man or a woman living in the LGBTQA+ community. None of these things matter. All people have a right to quality care related to sexual health. Managing MS symptoms, pain, spasticity, bowel and bladder issues, all of those things that can be a part of living with MS is essential to working toward a pleasurable and happy sexual life. Seeking support for those issues you are experiencing that directly relate to your sexual health, your sexual function, your sexual pleasure, need to be done as well. Keep asking, raise the questions. Be firm in your desire to understand and gain assistance. There is assistance available. Make sure that you ask for it and expect to receive it. And perhaps lastly, but no less important than any of the rest of this, make sure that on a social and emotional level, you are happy and healthy. Manage symptoms of depression, of dysthymia, of anxiety, of fear, of a loss of the sense of self and self-efficacy. Therapy, talking, sharing, hearing yourself speak. Such an important part of finding a happier and better place. And our social and emotional health is certainly very, very important when it comes to both our sexual health and our overall physical health. So all of those things, I believe, are at least a start to enjoying this very, very, very important part of our overall life.